What makes new seizure classifications so important for treatment? Imagine trying to fix a puzzle without knowing what the picture looks like. That's what it's like for doctors trying to treat seizures without clear classifications. The new seizure classifications are vital because they give healthcare providers a clearer picture of what kind of seizure a person is experiencing. This helps them decide the best way to diagnose and treat each individual case. When seizures are classified accurately, doctors can choose the right tests and medications, which can lead to better outcomes. The updated system simplifies things by reducing the number of seizure types from 63 to just 21. This makes it easier for doctors to remember and apply in everyday practice. It also helps ensure that diagnosis is consistent across different healthcare settings. The classifications are based on both biological factors and what the seizure looks like. For example, they distinguish between seizures that start in one part of the brain versus those that involve the whole brain. This distinction is important because it influences treatment choices. Another key change is how doctors describe seizures. Instead of just saying whether a person was aware or unaware during a seizure, the new system uses the term consciousness, which includes both awareness and responsiveness. This provides a more complete picture of how the seizure affects the person, helping to determine how urgent treatment should be. The new classifications are also flexible, allowing doctors to update their understanding as more information becomes available. This means treatment can be adjusted over time to better suit the patient's evolving condition. The inclusion of new seizure types, like epileptic negative myoclonus, helps identify less common seizures that might have been overlooked before. Recognizing these allows for more targeted treatment. Describing seizures by the sequence of signs and symptoms rather than just the first sign improves diagnosis accuracy. For example, knowing whether a seizure starts with a sudden stiffening or a brief loss of consciousness helps doctors choose the most effective medication. Most importantly, the new classifications focus on what can be observed during a seizure. Instead of relying on abstract categories, they emphasize observable features, making it easier for clinicians to identify and treat seizures correctly. This means that healthcare providers can better differentiate seizure types, which is crucial because different seizures often requiring different medications or interventions. For example, some seizures respond well to specific anti-seizure drugs, while others might need surgical options. In the context of epilepsy and seizures, these updates help doctors understand the underlying biology and clinical presentation more clearly. This leads to more personalized treatment plans, which can include medication adjustments, surgical considerations, or lifestyle changes. When seizures are classified accurately, patients are more likely to receive the most appropriate and effective care. Overall, these new seizure classifications serve as a bridge between complex seizure phenomena and practical clinical management. They support a more personalized, evidence-based approach to treatment, which can improve quality of life for people living with epilepsy. Remember, always consult healthcare professionals for diagnosis and treatment options tailored to individual needs.